Critical thinking in practice, how can we integrate it into the classroom?
My name is Lewis, a lecturer at Genuis University. I am integrating short cases, in my nursing class, for promoting the development of critical thinking skills. Short cases, which apply concepts being learned to hypothetical clinical situations, provide an opportunity for students to identify varied patient problems, propose multiple alternatives for resolving them, decide on the best approach from among those alternatives, and develop a rationale to support their thinking. My goal for this type of class sessions is to provide experiences for students to carry out in-depth analysis of clinical cases. A short case is a simulated clinical situation, but one with all the characteristics of an authentic clinical case. This type of classes guide students in the practice of their critical thinking skills with an emphasis on interpretation, analysis, and inference skills. The learning objectives is to focus on building students' ability to, first, identifying multiple patient problems using concepts learned in class. Emphasizing on interpretation and analysis. Second, proposing alternative approaches that might be used to resolve those problems. Emphasizing on inference and explanation. Third, arriving at an informed decision about the best approaches to use in the simulated case situation. Emphasizing on inference and evaluation. And finally, developing a rationale that supports their thinking and decisions, emphasizing on analysis and explanation.
Let us take it in more practical way, what you do before class begins.
Before class begins, I identify the critical thinking skills to be developed, then I write short cases with open-ended questions for the class.
How you write the case?
Each case usually has two parts. A brief description of a patient situation that relates to the concepts presented in the class, and open-ended questions about the case for students to answer in small groups. I keep the case descriptions short. I also integrate concepts learned in prior courses. The questions developed depend on the desired outcomes of the critical thinking class, e.g., interpretation, analysis, and inference.
Then, how you teach such sessions?
After presenting theoretical information about a patient condition, I begin the session with a sample case that presents problems and approaches that they have learned in one of the previous sessions. Then, I analyze the case for students, about potential problems in the case scenario, alternate approaches to consider, what I would decide for this patient, and why. Usually, students receive different cases to analyze, all of which relate to the clinical condition presented in that class and foster development of critical thinking. Students divide into small groups, with 3 or 4 students in each group. I only give them a limited amount of time, e.g., 5 minutes, to read the case and answer the questions. I limit the time, so students keep their discussion focused on the case and the intended outcomes of their group work. One student from the group presents the case and answers to the entire class. The other students then critique the responses and suggest other possibilities.
What do you expect from the class participants?
I expect each student to make a contribution to the analysis of and discussion about the case. When the cases focus on problem identification, I expect students to think about the data in the case, propose varied problems that might be possible, and explain how they would decide on the problem. If the questions for the case ask about interventions, I expect students to generate multiple approaches that could be used, using what they know and what they learn in the class.
How you evaluate the student work product?
Assessment of student critical thinking skills as applied to clinical practice occurs in 2 forms, through classroom testing using higher-level items and clinical evaluation. Higher-level test items present new information for interpretation and analysis by students. The most important assessment, though, is in the practice setting. In clinical practice, students can be observed on their competency in interpreting patient data, examining evidence, identifying possible problems, suggesting alternate approaches that might be effective for their patients, and evaluating those approaches to decide on the best possible ones.
One final question: how students perceive such method of teaching using short cases?
Student feedback about the short cases is consistently positive. Not only do students recognize the importance of learning how to apply concepts from class to patient situations, in preparing them for future practice, they comment frequently on the value of group discussion of these cases. By analyzing cases in small groups, students learn from one another and have a safe environment to discuss their thinking and reasoning. Additionally, analyzing short cases in small groups provides for active learning in class, which maintains student interest.
Are you ready to practice? Put yourself in students' shoes. You are a registered nurse providing consultation through a nurse telephone service for a group of pediatricians. You receive a call from a mother about her daughter's breathing problems and stomach cramps. The mother tells you that her daughter has asthma and allergies. Ask yourself the following questions for case's critical analysis. What questions would you ask the mother? Why are these questions critical to your decision-making? Add new data to this case, based on the mother's answers to your questions. Then ask again, what are potential problems of the daughter? And describe how you arrived at these conclusions.